I had some pain for some time on my right knee. So I says, well, I can't handle it anymore. I better go check it out. So I go see Dr. Renfro, and he said, well, looks like you should have a knee done. I said, well, not yet, Doc, if I really want it done yet.
When Mark first presented to the clinic, I'm not sure he was convinced he had arthritis to the degree that he did. So we did the usual things. We started with anti-inflammatory medication. I think he also had a couple hip injections. Once arthritis gets fairly advanced, those things help just temporarily and didn't really give him any lasting relief. And then we started talking about joint replacements.
It was one of those things you hate to do it, but then you have to do it. You get where you want to say, well, gosh, do I really need it? Can I live without it? And you say, no, I better get it done.
So we did his knee replacement first, and knee replacements take a good bit more therapy. And he did fine with that. He actually did very well with it. And then after his knee quit hurting, he started realizing his hip did hurt a lot.
Knowing Dr. Renfro I was pleased with the work he did on my knee. I was satisfied, and I said, well, I'll check him out again. I'll go see Dr. Renfro again for the hip. He did x-rays on it. He says, yes, looks like the bone is bone, they're working at it, we better do something. We set up an appointment, and I did x-rays, he looked at it, and I was in the hospital, I guess, again, at the center here for about 2-3 days. And then I went to rehab again for about, I guess, 3-4 weeks.
I've had some patients go back to work in 2 to 3 weeks, and again, it depends on what type of work you do. Usually by 3 months, we've dismissed a person, and they're still having some mild symptoms. But by 6 months, most people are completely over it, and they don't even realize they've had surgery done. Hip replacements more or less just need to get up and walk and do some simple exercises. And again, he did great with that. He's really able now to do more. He's an active guy. He's able to do things he wants to do. There's no limitations from his right hip and knee, and he's been very pleased with the result.
So far today, everything's fine, working beautiful. I'm running around dancing and doing the whole bit.